All right, so number 6 is the urine output replacement volume question. So the questions themselves are not going to show up very well here, but when I write with my marker, you'll be able to see my writing quite well. So sorry for the squeaking. I was moving my laptop. All right, so we'll start off with the fluid replacement. The question states 125 milliliters urine output replaced with 40 milliliters. The actual output is 500 milliliters. So the way I would solve question 6 as a setup, which you should see consistently with any question that is going to be like this, is you start off with what was the actual output. Okay. Divide that by the, the for every output. I call that the theoretical or the expected output. And then just multiply by the replacement volume. And when you do that, every single time, you'll get the right answer. So I believe this is 160 milliliters. So you can use dimensional analysis with this. It's actually how I came up with this. This here, you can use ratio proportion, which is another way I've seen this solved. But if you're looking for a simple formula for the fluid replacement questions, the fluid replacement for loss of volume, fluid volume questions, this is what I do. I take the actual output over the theoretical output times the replacement volume, and then I get 160 milliliters. Now, this is something that occurred to me, and this is going to be kind of like why you come to these review sessions. I'm going to give you an extra question. Let's say it's the same question, same replacement volume, but the patient's only lost 100 milliliters. Okay, so they voided out 100 milliliters in that 4-hour time period, but we still want to know how much to replacement volume to do. I'm going to do the same thing. I'm going to say my actual output was the 100 milliliters, and my expected is the 125 milliliters, and my replacement volume is the 40 milliliters. Okay, so I'm still going to set up the problem the same thing. The only thing that changed was how much they voided in that 4-hour time window, or whatever the time window is. And so when you do that, you will get a decimal answer. So let's see what that is. So I'm going to do 100 times 40 divided by 125. And I actually am going to get 32 milliliters is the replacement volume. Now, the other thing that I'll say about this question that's helpful is keep in mind that for every 125 milliliters lost, you're going to replace with 40. So if you lose more than 125 milliliters, your replacement volume should be greater than 40. And if you lose less than 125 milliliters, then your number should be less than 40. Okay, so don't get hung up like trying to overcomplicate this. Just keep those two facts in mind, or keep that one fact in mind, that your replacement volume is based off of the 125 in this particular question. And if it's above it, it's going to be greater than 40. And if it's below it, it's going to be less than 40. And as long as you know that, so like 500, obviously greater than 40, or I mean, so greater than 125, and 100 in this instance was less than 125. So you can rationalize through this question. All right, number 15. Oh. So 15, if you go to that link, that I've posted in the chat, that'll show you the specific way to do number 15. But there's a couple things you want to do. You want to first choose the correct syringe, which is syringe B, because it's the one that's measured in units. You have 10 units regular insulin and then 40 units of the NPH. So I always write and suggest that you write the solution amount to be drawn up first. You're going to do 10 units regular insulin first. Then the correct total medication is going to be 50 units. Now, when you're marking the syringe, you want to put a mark at the total 50. And your regular insulin is actually going to have a mark at the 40, because hypothetically, because you drew up the insulin first, the regular insulin would hypothetically exist between 40 and 50, with the remaining 40 being the NPH. So if I were going to indicate that, this is how I would do it. So I'm going to use my red marker. So 50 is the total. This number here between 40 and 50, I would write up this like little tilde, indicating that this is where the regular would exist. And then this over here is where the NPH would exist. I know that some people miss this problem. I can't remember if it was the second semester or third semester, but I think it was because there was a misunderstanding of how to correctly answer this question. And like I said, I would add this so there's no debate. 10 units regular first, and then total is 50 units. They really just want to see that you can mark the syringe. But this, according to the textbook, is how you're supposed to mark the syringe. All right, 17. All right, so 17. So this is a flow rate question. Flow rates are volume over time. So it tells you that the patient's to receive tube feeding of Ensure 120 milliliters over 90 minutes. And then we want to know what the flow rate would be in milliliters per hour. So this is 17. If they're supposed to, so what is flow rate? Flow rate equals some volume over time. Okay. So we don't need to necessarily make this any more difficult than volume over time. So what is the volume they give us? They sell us 120 milliliters. What is the time they give us? 90 minutes. Now, if they wanted it in minutes, we could just reduce this, but they said, what is the flow rate in milliliters per hour, which is the typical way that we acknowledge flow rate. So you're going to do a couple things. I'm going to show you two different ways to answer this question. The first way is just doing dimensional analysis. 60 minutes in an hour. You know you've set it up right because you can cross out minutes, and then you'll be left with milliliters per hour. So you would just multiply 120 times 60 divided by 90 and get your answer. Or alternatively, you can take the 120 milliliters, and you already know that 90 minutes is what? 1.5 hours, right? So 1.5 hour, and you'd come up to the same answer. So using our trusty calculator, I'm going to do the first scenario, 120 times 60 divided by 90 will give me 80 milliliter per hour. And then if I do 120 divided by 1.5, I'm also going to get the same answer, 80 milliliters per hour. Okay. Number 20. Let's see what 20 says. Okay, so 20 is one of your first looking at drop rate type questions. I mean, there was, I think, one or two above this, but number 20 says the physician ordered 1440 cc's of dextrose 5% normal saline to be infused over 12 hours. And then if your tubing is labeled as below, what would the rate be in drops per minute, where the label tells you it's 10 drops per milliliter. So when we're calculating drop rates, right, we need two pieces of information. we need to know the flow rate. We need to know the drop factor. And those two pieces of information will give me the drop rate. Flow rate could be in milliliters per hour. It could also be in milliliters per minute. And then I think you already know that milliliters and cc's are the same thing. Drop factor is drops per milliliter. And the drop rate is usually going to be drops per minute. And you can't give someone a partial drop. So your drop is always going to be in the whole number. It's going to be a whole number. So if you get like 49.99, it's 50 drops. Okay, just in case you run into that. So this question says we have 1440 cc's infusing over 12 hours. I have a drop factor of 10. Okay. And I want to know how many drops per minute that is. So there's a couple things you need to do here. You need to account for and convert hours to minutes, and you can do that any number of ways. So let's just look at a couple different ways. I'm just going to do like a little aside over here. So 12 hours times 60 minutes equals 720 minutes. Okay, so that's one way of doing it. And that might actually be the most straightforward way. The other way you can do this is if you reduce 1440 over 12, I believe that gives you 120. 1440 divided by 12 would give you 120, and that would be milliliters per hour. And you know that 1 hour is 60 minutes. So you have a couple of options for setting this up to get to this point. But let me just show you the long dimensional analysis way, which is I'm going to add another multiplication here. And I'm going to say that 1 hour is what? 60 minutes. Then what I'm going to do is I'm going to multiply across the top, 1440 times 10, 12 times 60. Now, if you do one of these options here, where you convert hours to minutes, or you reduce the 1440 over 12 to 120 milliliters per hour and then convert hours to minutes, if you do that first, then multiply by 10, you'll have your answer. Okay, so 1440 times 10 divided by 12 divided by 60, and we'll get 20 drops per minute. All right, 21. All right, so 21. Okay, 21 and 22 are going to be solved the same way. And these are your reconstitution questions. The first one says that you have an order of 60 milligrams, and then they have 3 options of vials, and it says to choose the strongest concentration. So the strongest concentration is always going to be the one that gives us the most milligrams, or the most quantity per milliliter. So 20 is greater than 10, and 10 is greater than 5. So if it asks for the weakest concentration, the middle concentration, or the strongest concentration, that's how you would choose that. So for 21, you've already done questions like 21. You're going to take the order times the conversion, which is the 20 milligrams per milliliter, and you'll get 3 milliliters to administer for the dose. Okay, so the strongest concentration is the one that's the highest number. And the only way this could get tricky is, let's say instead of 5, 10, and 20, it said 5 milligrams per 2 ml, 10 milligrams per 3 ml, 20 milligrams per 4 ml. That might make things a little bit tricky. And then you'd have to reduce it to milligrams per milliliter in order to get that down. Now, here's the thing. on a drug label, like when what the pharmacist might look at, or if you ever see like the original label, I think it's to my knowledge, it's required that they have it in its reduced form as well. So like, let's say it was 20 milligrams per 2 ml, it'll say or 10 milligrams per milliliter. So it'll reduce it automatically. But on the test, you have these examples where you're not getting the whole label. So just trying to figure that out. For 22 with the Pfizer pen question, the order is 750,000 units.
Farad,
Oh, go ahead.
please, can you do the 21 again?
Oh, yep, it's right there. It's just 60 divided by 20.
So you said among the three, you choose the strongest concentration.
Correct. Because that's what the directions told me. Right? Determine the volume in milliliters for the strongest concentration.
Yes,
Yep.
That's true. Thank you.
That's why you chose it. Yeah. All right, so 22 also tells you to use the strongest concentration, and 22 also has some extra information that you do not need in order to answer the question. So 22 says, or 22 has 2 columns here. Now, when I'm calculating concentrations, I only need to know a couple of things. Sorry, hold on one second. There we go. I only need to know a couple of things. I need to know the order, and I need to know how to convert the order into milliliters. So this column right here where it says milliliters diluent added, that just tells the pharmacy how much deionized water to add to the powder to get to these concentrations. So I'm going to add 3.2 milliliters of water to the powder to get 1,000,000 per units per milliliter. I'm going to add 8.2 milliliters. So more water, more dilute, and then even more water, even more dilute. So when we talk about the strongest concentration, it's the one that has less water in it. So the only thing that this milliliters diluent added might help you with is choosing which one is stronger, but you don't use this information to solve your questions. This just tells the pharmacy how much water to add to get to these concentrations. So for solving this question, 22, you're going to take your order, which was the 750,000 units. And then you're going to multiply by the strongest concentration. So there's 1,000,000 units per milliliter. When you do that math, you will get an answer of 0.75 milliliters. And that is your answer. Keep it in mind that when you're rounding a number less than 1, you're going to round to the nearest hundredth place. So you want to leave that. So like, let's say this was 0.755, then you could round that to 0.76. But because it doesn't, because it stops at the 5, you stop at the 5. Okay. Do not round this to 0.8. That would not be the right answer. If you have a number greater than 1, so let's say this answer was 1.75, then you would round to 1.8. Okay. Because numbers greater than 1, you round to the nearest.
You said when will you round it 0.78? Can you say that again, please?
I didn't hear the question. I'm sorry.
I think you were saying you can round it to 0.8, if I heard you correct.
No. I said do not round it to 0.8.
Okay. Thanks.
Yep. I have the answer here. So like, let me just do that real quick. I'll go over the rounding rules, which is in your packet, but it's helpful to review. So rounding rules. Okay. So first of all, when you're dealing with drops, okay, so the GTT, the drops, you're going to round to the nearest whole number. Okay, round to the whole number. So as an example, if you get 49.9, that answer is going to be 50. Because again, you can't give a partial drop. If you have a number that's greater than 1, you're going to round to the tenths. Example, if I have 1.75, I'm going to round that answer to 1.8. And if I have a number that's less than 1, I'm going to round to the hundredths. And the example here is, let's say I have 0.175. I would round that to 0.18. With the goal being with rounding, at least for CCAC Allegheny nursing program, is to have 2 significant figures in your label. When you get out into the real world, you may not be able to administer some of these medications with a fraction, or even program your infusion pump to the tenths place. That'll all be based off of what you have available and what the order is. But you'll find all that stuff out when you get into what I call the real world. All right. I think someone said 25 as well. Oh, no. Okay. Okay, so that was all the questions that were asked so far. Are there any other questions from the practice test?
Please, can you redo the replacement question?
The urine?
The replacement question.
Number 6?
Yeah.
Okay.
Yes, sir.
So what I'll do, I'll just pull up my notes here. Okay. So as a reminder, for number 6, you're going to take the actual output and you're going to divide by the theoretical output. So the output that that they gave you at the beginning of the question. So 500 over 125. So 500 was what the patient actually voided. 125 is the expected voiding. And then you just multiply by the replacement volume. Now, all 3 of these numbers can change, but the setup is exactly the same. Take your actual output over the expected output times the replacement volume. So as an example, let's say this question said, I'm going to pull up the wording here. Let's just say this question was stated as such. Over the last 4 hours, the patient has voided 600 milliliters. For every 120 milliliters of urine output, you're going to replace it with 25 milliliters of water. So notice I changed everything. I even reorganized how I said this. I started this statement first, and then I included this statement second. It doesn't really matter the order. What matters is you take the actual output. So in the example 6 is 500 milliliters. My example, I told you, was 600 milliliters. You're going to divide by whatever the replacement or the expected or every urine output is. So 125 in your practice test, or the sample was 120, and then replace with 40 in the practice test, or in the example I think I said 20 or 25.
Thank you.
You're welcome. Yeah, and then this one down here was just another sample of using the same replacement volumes, but what if they only voided 100 milliliters? That's how you would make that calculation. And I should also tell you that the time really doesn't make a difference. It just depends on, because they could have voided 100 milliliters in the first hour of the 4 hours, or it could have been, in the last hour of the 4 hours. It really doesn't matter. That's just tells you when you collected it. So like if for some reason the question said every hour or every 4 hours, every 4 hours is just when you're checking it. So don't get hung up on the time, just get hung up on actual over theoretical times the replacement, and you'll get that right every single time. So for 16, sorry, Dora, I had muted you. I apologize. You can unmute if you want to. All right. So for 16, again, with drop rates, you need two pieces of information. You need the flow rate and you need the drop factor. And those two pieces of information will give you the drop rate. Okay. So the flow rate they give you is 75 milliliters, 25 minutes. The tubing, there's a picture and it says 15 drops per milliliter. And you do 75 times 15 divided by 25, or 75 divided by 25 is 3 times 15. Either way, you get the same answer of 45 drops per minute. Now, what some people do, what some students do is they'll convert minutes to hours to get the flow rate in milliliters per hour and then convert it back to minutes. If it's already in minutes and you're ending in minutes, leave it alone. Don't convert it. We're calculating flow rate. It tells me 120 milliliters, 90 minutes. And it just wants to know how to convert that into hours. So so remember, it's always going to be volume over time, because you told me divide by 120 milliliters. And then what I'm trying to tell you is don't divide by 120 milliliters. You want to take your 120 milliliters divided by the time. So if you converted hours to minutes and then 120 divided by that number, that would be correct. And then I said you could set this up two different ways. You can say 120 milliliters, and you know that 90 minutes is 1.5 hours. And then just 120 divided by 1.5 will give you your answer. Or you can convert minutes to hours using dimensional analysis. And either way that you set this up, you'll get the same answer.
Okay. Thank you.
You're welcome.
Please, can you do the next question too? The sodium 500 milliliters.
Yeah. All right. So this is a similar question, but this time they just want to know how long the pump is going to run for. So for 18, you have a 500 milliliter IV running at 125 milliliters per hour. So I'm going to, again, use dimensional analysis to kind of help me set things up. I want to go from milliliters to hours. So
is this a flow rate question? I'm sorry to ask.
In 1 hour. And then you just do the math. Go ahead. I'm sorry, what were you saying?
This is a flow rate question, right?
Yes, but in this question is asking how long it will run for. So you don't have to calculate milliliters per hour, but you're using milliliters per hour to solve your question. So like the example I've heard used that I think is helpful is you have a patient who's on this 500 milliliter IV and you want to know when you need to go change it. So let's just say it's just like, they're just on fluids and they're going to be on it for the duration of their stay at the hospital. How often do you need to change that bag? Is it every hour? Is it every 8 hours? Is it every 4 hours? What is the duration. And so that's how you would calculate that out.
So this one, you don't use any formula. You just use dimensional analysis.
Right. I always say that even the flow rate question up here is we're using dimensional analysis. So you with dimensional analysis, you never need a particular formula. But if you let's say you just did 500 divided by 125, you're doing that right. So as long as you set it up that way, you don't
so
have
here
to
the 500 would be the flow rate. That's all or the
the
125 would be the
flow
flow
rate
rate.
is 125 milliliters per hour. So the rate is always volume over time.
And then the 500 is the what?
500 is how much is in the bag. How much is in your IV?
Times 1 hour over 125. 125